Do you suffer with chronic back or neck pain and you've been told you need surgery? Our next guest says it's important to weigh your treatment options first. This is Dr. David Baranko, a neurosurgeon at Barrow Brain and Spine, and he's here to tell you how to decide whether you actually need back or neck surgery. Great to see you.
Good morning.
And I was just chatting with you, and it's really appalling how many people are told, guess what? You need surgery. Why are so many people suffering from back and neck pain anyway?
Well, back and neck problems are one of the most common conditions that people see their primary physician. Headaches and spine problems, high on primary physicians' lists. And so for most Americans, 80% will see their physician at some time in their lifetime due to a severe back or neck problem that needs to be treated, and it usually resolves. So as we live longer, obesity rates increase, we're not as fit maybe as we should be, the wear and tear on our spine increases, and we have more back and neck problems.
Okay, so Dr. Baranko, I call my primary care, I go in for my appointment, and he tells me I need surgery.
So the most important thing to remember is don't panic, because the overwhelming majority of patients who have back problems or neck problems don't need surgery. What most people don't realize is that 80% of people who have significant back or neck problems, it can be due to a herniated disc or bone spur, don't need surgery and will get better within 10 to 12 weeks just with conservative treatment.
And conservative treatment, this is what was so great about what you and I were talking about. You all there at Barrow have a specialty clinic just designed for those options out there. What are they?
So we have clinics obviously with surgeons in it, but we have other clinics downtown in Phoenix and also out in Scottsdale where we have just conservative management of spine problems because they are so common and because they can be treated that way. So we have physiatrists and spinal rehab physicians, pain physicians, physical therapists, MRI facilities, all to treat people conservatively so they can avoid surgery.
Wow, the importance of that second opinion.
Second opinion is very important. There's no doubt from the literature and everything being reported now that spine surgery is being overdone nationally. Our rates are higher than other countries. So when a person is told that they have some type of problem on their scan, they need surgery, most likely they don't. But if they're told they do need surgery, it's always a good idea to get a second opinion when possible, because there's no harm in that.
All right, so we've done the alternative treatments. They didn't necessarily work for us, and we do need surgery. So can you kind of walk us through? I know you brought some examples.
Sure.
When is the right time to have surgery?
Well, the spine obviously is a complex thing, but the patients who need surgery fit into two main groups. There are the patients who have a pinched nerve and the compression on the nerve may be so severe that they have either neurologic dysfunction or nerve damage. And those patients need to see a board-certified neurosurgeon to do a thorough neurologic exam to see if they have nerve damage, because if they do, they need to be treated urgently.
Okay.
That's the minority of patients. The largest group of patients have either pain or numbness or tingling, and it's due to something compressing the nerve like a herniated disc, or it can be due to a bone spur compressing the nerve. And in those patients, as I said, the majority will respond conservatively, but they might need to consider treatment if they don't respond and the degree of pain is just so severe that it affects their activities of daily living, either at work or at home.
And the same with the neck as well.
Right.
All right. Well, thank you. Such great information.
No problem.
We appreciate you. If you would like more information about back and neck treatment options, we encourage you to visit barrowbrainandspine.com. That is a website. And if you have questions, please pick up the phone 602-406-8450 for more information.